Thank you for joining us today for ABA's Civil Rights and Social Justice Chair Chat. My name is Charlie Sabatino. I'm the former director of the ABA's Commission on Law and Aging, and I currently co-chair the Elder Rights Committee for the section on Civil Rights and Social Justice. I'm excited to welcome you today to this conversation. These chats are a unique opportunity to engage directly with the key issues at the heart of our work in civil rights and social justice, and to explore perspectives of our expert panelists and spark discussions that inspire action among the legal profession. Today's topic addresses the civil rights of nursing home residents. It arises in connection with the article on marginalization of nursing home residents in the March 2025 issue of Human Rights Magazine. The topic is more critical than ever as we confront an aging America and possible cuts to aging programs nationally. It's important to examine how these issues intersect with the principles of justice that guide and equity that guide the work of the ABA. We are honored to have with us today Alice Bonner, chair of the Moving Forward Nursing Home Quality Coalition. She's been a nurse practitioner for over 30 years and currently senior advisor for aging at the Institute of Healthcare Improvement, or IHI. From 2015 to 2019, Ms. Bonner served as secretary of the Executive Office on Elder Affairs for the Commonwealth of Massachusetts. And from 2011 to 2013, Ms. Bonner served as director of the Division of Nursing Homes in the Center for Medicare and Medicaid Services in Baltimore, Maryland, which is, those of you who know anything about nursing homes, that's really the key federal agency involved. Her perspective and dedication to long-term care quality has made her a recognized leader, a national leader in this field, whom I've had the honor of working with for the last 2+ years. I'm grateful for your willingness to converse with me today about this very important topic. So to kick us off, let me just give a quick snapshot of the nursing home industry today and then ask you to address a little bit about the history of quality in it. I mean, today we have nearly 15,000 nursing facilities around the country, serving more than 2.1 million residents. Those residents are largely poor and older, with about 62% of them being Medicaid funded in nursing homes, which is the program for low-income persons, and 2/3 of them being over age 65, and nearly 20% of them over 85. So it's a very insular part of our society who reflect the oldest and the sickest among us. And it's had a long history going back to the 60s with quality issues. And I wonder if, Alice, you can give us kind of a thumbnail snapshot of how we've struggled with quality over these years.
Sure. And thank you so much for all the work you're doing with us and, to promote the voice and amplify the voice of nursing home residents. You started out by saying, today we're talking about the civil rights of nursing home residents, and it's absolutely critical because, to your point, those statistics you just cited, only about 4 to 5% of people who are over age 65 actually live in a nursing home. So that's a much smaller percentage of the population than those who are living in their own homes and in communities, assisted living, et cetera. So part of the issue here is a couple of things about people who live in nursing homes. First of all, a lot of them do live there because they need assistance with things like what we call activities of daily living, bathing, dressing, eating, walking, using the bathroom, et cetera. And they're not easily able to just leave the nursing home and go out and, for example, speak to people in Congress or speak to people in their state legislature. So when there are quality issues, as you had mentioned, Charlie, and they're going on, we don't often hear from the people who are directly affected by it, the people who are living there. In addition, a lot of those individuals, as you mentioned, are over 65, over 85, and their family members or care partners, people in their lives who know about what's happening with their quality, are also not always able to get away from caring responsibilities or other responsibilities in their lives in order to really bring these issues forward. So I think overall, there has been for a long time now probably throughout the history of nursing homes, there's just been a limited amount of advocacy. And, everybody's on the same team here, right? I mean, we all want the best quality of life, the best quality of care, but making sure that the voice of residents is really heard and amplified is a big part of what we do at the Moving Forward Coalition, and many of your listeners on this, to this podcast as well.
And talk a little bit about how the Moving Forward Coalition came about, that you are chair of.
So, back in 2022, there was a group of people who came out with a report after a couple of years of work, and it was sponsored by the National Academies of Sciences, Engineering, and Medicine, and it was called the National Imperative to Improve Nursing Home Quality. It's about a 600-page report. I have it right over on my bookshelf there. It's dog-eared and has a lot of Post-it notes in it. But, that report with its 600 pages had many, many recommendations from national experts, some of whom may be listening on this call. And what happened was, a lot of foundations and organizations came together and said, well, this would be terrible if this really helpful report with lots of evidence-based programs just sat on a shelf and nobody did anything with it. So we were generously funded by the John A. Hartford Foundation to take that report and distill all of those recommendations down to literally a handful. And say, okay, here's a handful of those 600 pages of recommendations. And what we're going to do is we're going to just focus in on those, and we're going to write action plans. We're going to post them on our website, and we're going to begin to test and implement those action plans. And that's what, as you know, the Moving Forward Coalition has done. We started with, reaching out and getting lots of recommendations from other people about the best folks to come in and lead committees. So we formed 7 committees. We had great co-chairs from around the country. And those committees, again, put together 9 action plans. We currently have, in our second round of funding, also from the John A. Hartford Foundation, we now have distilled it down to 3 priority projects, and I can talk more about those in a bit. But again, we now believe that if we focus really, really narrowly on these 3 priorities and spend a lot more time digging deeply into those priority actions, we're going to be able to have greater impact. So that's where we are today.
And I can say from my personal experience that one of the things that attracted me to the Moving Forward Coalition after I left the ABA Commission on Law and Aging was the notion of civil rights status of nursing home residents, and particularly the fact that our nursing home stock are largely big facilities, based on an institutional design going back to the 1960s and 70s, which was really
or even earlier,
emulating hospitals at that time. And we still have that model as the predominant model in the nursing home industry. There are some wonderful exceptions to it, but they are the minority. The norm is still that nursing homes have generally more than 100 beds, residents. And when one goes into a nursing home, as much as we talk about trying to respect their goals and preferences and have person-centered care, we nevertheless put most of them in double or bigger rooms where they lose their personal privacy. They have no access to a kitchen anymore. It's a remote institutional kitchen that dictates the food that they get generally. These older nursing homes have long hallways that look like old hospital corridors with nursing home stations and medical carts and hard surfaces, and they are not homes, even though we call them homes. And that's I think a very serious civil rights issue. As I often say, the only 2 populations that we use long-term institutional care for are convicted felons and very old sick people who go into nursing homes. That shouldn't be the case. Yet it has been the case for so long that society has sort of accepted as the default that we can do nothing about. And one of the driving forces of the Moving Forward Coalition and the people who make it up is the belief that we can do something about it. And I really believe that the legal profession needs to help step up with these advocates to make a difference. We have largely people with great, clinical understanding of what good care looks like and what quality care looks like. But that's not enough in the advocacy world to make this happen. We need the legal expertise and the legal punch to do it. So that's really where I'm coming from on this. So I've gotten, and that's really one of the parts of the Moving Forward Coalition that is still moving ahead. We are trying to look at states that have taken steps to incentivize changing the model from the institutional model to what we call the small household model. And maybe, can you talk a little bit about what the small household model is and where it exists today?
I can, but first I want to just put a fine point on what you just said about the legal profession playing a role in advocacy and bringing some of these issues forward. It is absolutely true that we are not going to accomplish what we want to about, nursing home quality of life without lots of different types of organizations and groups and individuals coming together and speaking with a loud voice, being powerful, because it's the strength of numbers and the strength of different types of entities coming together and saying the same thing that's going to matter. The difference between one phone call or one visit to a congressman or woman or a state legislator versus 100 phone calls or 500 or 1,000 is that order of magnitude. It really matters. So I would just echo what you said. The legal profession being involved, the advocacy organizations being involved, outside of healthcare, municipal leaders, mayors, town councils, selectmen. These roles really matter. People at the state level, people in Medicaid. Medicaid, as you said, pays for 60 to 70% of long-term, nursing home care. So anyway, just I hope people who are listening are thinking about this, and I really hope some of the people listening are involved in these advocacy organizations. We have the National Consumer Voice on our steering committee. We have SEIU on our steering committee. We work with Justice and Aging. They've been on working committees. We talk with, LTCCC and Medicare. There's other organizations, the Center for Medicare Advocacy. So anyway, back to your point about small homes. For anyone who has been a patient for short term or has been a long-term resident in any of these organizations that you described, it's just it's not at all home-like if you're in one of these older buildings. Not only for the design issues that you raised with the long hallways and the nurses station in the middle where there's lights and beeping and noise and big food trucks coming by, and it's been like this for decades. But also just that it doesn't create an environment that feels like your home. And so again, you really have to be there for a period of time. It's good when people visit nursing homes. By the way, 50% of people who live in nursing homes never have a visitor. That's a crazy number, but we've seen that in other similar statistics. So visiting a nursing home is really good. And we hope people visit. We hope they'll volunteer. But, I started out Charlie knows this. I started out as a nursing assistant back when I was in college, when I was 19. I didn't know anything about nursing homes. And it was a shock to me to sort of, see what this environment was like. But 40 years later, I'm still really interested in thinking about, what are the different ways we could do things differently. But the design of the physical environment is a big part of that. And if you're a worker, whether you're a nursing assistant or an LPN, RN, social worker, medical director, it influences how you're able to do your job, how you look forward to your work, whether you have, you feel joyful about going to work. And that's for the workers, but the really important thing is the civil rights of the people who live there. So what can we do? To Charlie's question, what can we do to have more nursing homes, either, ones that are being built, which is very few right now, very few, or more importantly, ones that could be converted easily or relatively easily converted to, having single, private bedrooms, private bathrooms as much as possible, or at least, for us to get rid of any 3 and 4 bedrooms for sure. And again, there's a whole lot of issues that, Charlie, the work group you've been leading has been looking at, because it's, nursing homes need to be able to do this in a way that is going to allow them to sustain their financial model and also support, the quality that they want to be delivering. So I would say, again, the state by state approach is really important. And that's why Moving Forward Coalition has been developing these state profiles. You and the team have been developing these state profiles. We're also working with students at Weill Cornell with Dr. Mark Unruh, who's faculty member there, and they are also studying some other states and looking at barriers, challenges, opportunities, and trying to create these profiles, as you guys are doing, of where there have been more of these small home models and other models that really think about the culture within the organization and on the campus, and really promoting quality of life, which is not always related to people's healthcare. You and I are older adults. I don't think about my healthcare every day. Sometimes I do, but there's a lot of other things that are important to me in my life. And, we need to make sure that those things are being addressed. So I'll just say very briefly, this is not related to small homes per se, but again, I think can tie in. We have 2 priority projects related to civil rights of nursing home residents. One is asking people when they come to live in a nursing home what their goals and preferences and priorities are. Because if you don't ask me, you don't know what the most important things are to me. So that's a project in the state of Kansas with 6 nursing homes and Kansas State University, and led by Lacey Cornelison, who's faculty there. And again, I think it just ties in. The physical environment's important, and it's important that we ask people what their goals are. The second priority project is in the state of Connecticut, where the long-term care ombudsman program is leading work with 25 nursing homes, and ultimately is going to scale to all 250 in that state, strengthening resident councils. And again, that gets back to the civil rights of, I live in a nursing home, I'm a resident, I have the right to get together with other residents in that building as often as we want to talk about issues, ideas, bring recommendations. And most of those resident council meetings happen roughly monthly, but the nursing homes are required in the regulations to support that in whatever ways the residents want the support. So again, that's a big project. That's going to be a statewide project over the next 2 years. And Mairead Painter, who leads the ombudsman program, is at the helm and doing great work with the team. So back to you. More than you wanted for an answer, but there you go.
Well, and I want to add that, this is not a new topic for the ABI either. In my years at the Commission on Law and Aging, and continuing today under their current leadership, they are involved with many of those organizations that you mentioned: Justice and Aging, the Nursing Home Quality Coalition, and Long-Term Care Quality Coalition, and others. And the ABA has some very strong policies on this. We actually have a policy enacted in 2021 that urged CMS and HHS to review its size and quality guidelines to promote the small household model. And also we have some very strong transparency policies calling on the federal government to make sure we have greater transparency of nursing home ownership and transitions of ownership and review of those. So this is something that is not new for the ABA, but I think it needs a much more grassroots effort from lawyers to get involved, particularly the part of it that is very policy and finance oriented is the small household transition, because most states have policies that require building standards that still continue to look like institutions, particularly around kitchens and safety matters that go far beyond what you have in your own residential home. The examples that are out there of this residential model are worth looking at. In most states, there are examples of small household models. Probably the most organized group is the Greenhouse Project homes. They're not the only small household model out there. There are other advocates of small households and culture change, the Eden Alternative, the Pioneer Project, and others. If you look in your state, you'll find some kind of culture change coalition or group advocating, and you can connect with them. But if you look at the small household models like Greenhouse, you'll find that they look like a regular house on the block when they're built as individual houses. And the interior has a living room, usually with a fireplace, has an open kitchen that people have access to 24/7. All the icons of medical care are kind of hidden. Their rooms are private rooms with private bathrooms. So they really are homes. And if you can imagine an old style 3 or 4 story institutional nursing home, that can, in many cases, be converted so that it becomes individual apartments. One wing of one floor could become an apartment with 10, 12, 15 residents with single rooms, having a more living room and residential type of environment. It might have its own individual kitchen, or at least kitchens can be combined so that they're smaller and accessible to people 24/7. So these models actually exist out there right now, and they have for a couple decades, but they are still a very small portion of the industry. To get the industry to change does take money. It's expensive to convert an old nursing home like that, and there's not a lot of places to build new ones. So it really requires incentives, both on the financial side and on the regulatory side, because regulations need to be rewritten so you don't have to get waivers of 25 different things in order to get approved. They should be standard building code guidelines to allow you to do this. And the kind of incentives out there are not unheard of. We provide incentives for low-income housing. We provide incentives at the state level for energy efficiency, for business development zones. You name it, we have incentives in both federal and state policy, but we aren't doing it for nursing homes. And that's one thing that lawyers can be really good at doing. The legal profession has been involved for many years in deinstitutionalizing and improving the care of persons with mental illness. This is just as vulnerable a population, and it's something we can step up on.
Right.
So,
and I would add to what you just said. So, you said it really well. One of the ways, one of many, where the legal profession can step in and be helpful is coordinating among federal agencies and among state agencies. So, we have Health and Human Services, Department of Education, Department of Labor, Department of Housing, Department of Transportation, and they're all like siloed, these agencies, and they don't talk to one another. Another part of the work that the Moving Forward Coalition did was related to making some recommendations to HUD, Housing and Urban Development, related to, again, some of the comments you made. How could we make this easier for nursing homes to do some of this work, whether it was small homes or some of the other conversions? And again, people think that HUD doesn't have anything to do with nursing homes, and it turns out there's some loans and other services that do relate to nursing homes. So it didn't really move too much farther along with them yet, but we're still remain optimistic. And I think, again, to your points, Charlie, the legal profession is really important in terms of regulations, in terms of legislation, in terms of support and raising awareness and talking about this stuff. It's one thing for me as a nurse practitioner and person who's done some policy work to be talking about this, but it matters a lot that other organizations outside of healthcare are also doing that. So I think we've talked about many of them here, but Again, people in the community, people who are, retirees or young families or anybody at all in the public. It's important that you speak up and say, in our city and town or in our state, what is currently going on with quality in nursing homes and what could we do to improve that? And, getting people really to come together. It's the big issue here is people are just not talking about all of the individuals who live in nursing homes. And again, because it's a small percentage of the population, and people don't visit very often, that's where we are. And so we need to be much louder about this and much more powerful about this. The vision of the Moving Forward Coalition is that every nursing home will be a community in which lives are nurtured, residents are empowered, and where people want to work. So actually, our third priority project is on the workforce and career advancement for certified nursing assistants through apprenticeship programs. So that's our third. That's why I was in Chicago. We were just meeting with all of the geriatric workforce enhancement programs. But anyway, back to you.
Yeah, and the workforce issue is so important, and that really ties back into this whole push that I have for the small household model, because people like working in that environment as opposed to institutional environments. And one of the continuing chronic issues we have in nursing home care, as you know, is the huge amount of turnover of staff.
Right.
Facilities can't keep staff. Anyway, with that, the last thing I want to say is that in addition to all the suggestions we've made, right now all these programs face tremendous threats of being cut fatally, including programs like the Ombudsman program and the Administration for Community Living. So among all the other issues, lawyers are very powerful at defending programs. We're used to doing it with programs like the Legal Services Corporation. We can be just as powerful with protecting programs for aging adults like Ombudsman and Administration for Community Living. So let's all get moving. And with that, I'm gonna bring us to a close. Thank you, Alice, for such an engaging and thought-provoking discussion. Your insights have not only deepened, I hope, our audience's understanding of the topic, but also reminded us of the ongoing commitment needed to advance civil rights and social justice. To everyone who joined us today, thank you for being part of this important dialogue. The issues we've explored are complex and challenging, but by coming together in spaces like this, we're taking meaningful steps towards progress. Remember, the work doesn't stop here. It continues with the actions we take in our communities, our workplaces, and within the ABA. I encourage you to stay engaged with the ABA's Civil Rights and Social Justice section. Visit our website, explore upcoming events, and consider joining one of our committees, such as my Elder Rights Committee, to help shape the work we're doing. You can do so at ambar.org/CRS. Once again, thank you to our speakers, our team behind the scenes, and of course, all of you for making the time to come here. We look forward to seeing you at our next chair chat and continuing this vital work together. Thank you.
Thanks a lot.